Hey, this is Brooke, functional medicine dietitian specializing in fertility, and this is the Fertility Dietitian podcast, where I help you uncover the barriers that are preventing you from optimizing your fertility and teach you how to work with your body to finally take home a healthy baby. Each week, I will be diving into different topics on fertility and sharing my perspective on physiology, metabolic health, nutrition, and lifestyle approaches that have helped hundreds of couples get pregnant even after years of heartache. My goal is to empower you with the knowledge you need to take back control of your fertility. Happy listening. If you've been told that surgery is your only answer for endometriosis, or maybe you've already had surgery and you're still struggling to get pregnant, this episode is for you. Keep on listening. I want to be really clear, first off, that I'm not anti-surgery at all. In fact, when surgery is needed and when it's performed by a highly skilled excision surgeon, it can be one of the most valuable tools available for someone with endometriosis. But it's not the end-all be-all. What I am against is the idea that surgery alone fixes endometriosis, because it doesn't. So today we're going to talk about why endometriosis surgery doesn't always solve infertility, what surgery can and cannot do, and why supporting the rest of the body before and after surgery can completely change your long-term outcomes. So let's get into it. One of the biggest misconceptions about endometriosis is that it's simply a reproductive disease. It's not. It's far from it. Research increasingly clarifies that endometriosis is a chronic systemic inflammatory disease that's closely connected with immune dysfunction. That changes everything with treatment and management, or it should. When we only focus on removing lesions, we're treating one expression of the disease. We're not necessarily changing the environment that allowed those lesions to develop in the first place. About half of your risk for developing endometriosis actually appears to be genetic, while the other half, the other 50%, is influenced by your environment and your lifestyle. That's a really big half that you actually have control over. That means that your nutrition, your toxic exposures, your gut health, your immune function, your hormones, your nervous system health, sleep, inflammation, mineral status, and really overall metabolic health influences how this disease behaves. That should feel incredibly empowering. Your genes may load the gun, but your environment often pulls the trigger with overall expression. Many women are surprised to learn that infertility can actually be one of the very first symptoms of endometriosis as well. So, not everyone experiences debilitating periods. Not everyone has severe pelvic pain, but some women don't actually realize that they have endometriosis until they're actually struggling to conceive and end up getting that exploratory lap procedure. But once we understand that endometriosis is an immune and inflammatory condition, it can help make it a lot more sense in how we manage it and how we approach endometriosis and fertility together. Because fertility depends on healthy immune function, with endometriosis or not, right? It depends on balanced inflammation. It depends on healthy egg quality. It depends on proper inflammation as well. And when those systems are disrupted, pregnancy becomes much more difficult, even before pain potentially becomes one of the symptoms. This is also why so many women with endometriosis experience symptoms that seem completely unrelated to their pelvis. Symptoms like fatigue and migraines, digestive problems, bloating, IBS-like symptoms, autoimmune conditions, chronic pain in other areas even, like lower back, heightened pain sensitivity. These symptoms are not random. They're clues that endometriosis is affecting the whole body. Okay? So back to surgery. When it's performed by an experienced excision surgeon, excision surgery is considered the gold standards. And one of the first places I always recommend exploring excision surgery is via a NAPRO provider, because they are really going to emphasize restorative reproductive medicine, and making sure that they're restoring that reproductive environment the best they can while they're taking out the lesions in a very skilled manner. Excision actually removes the lesion from its root. That's very different from ablation surgery. Ablation burns the surface of the lesion, but deeper disease actually remains left behind. That is one reason that recurrence rates after ablation are significantly higher. And studies are going to suggest that a recurrence after ablation may reach 40 to 60% within just 1 to 2 years. Okay. Excision, on the other hand, when it's performed by an expert surgeon, has much lower recurrence rates, roughly 7 to 14% over 6 to 12 years. That is a dramatic difference. So if surgery is appropriate for you, finding the right surgeon matters big time. Excision surgery can remove visible and deep infiltrating lesions, actually restore the pelvic anatomy, reduce inflammation within the pelvis, decrease pain, improve fertility for many women, particularly when distorted anatomy has been preventing conception. And those are all really huge wins. But here's what surgery cannot do. It cannot reset immune dysfunction. And if you've listened to episode 73 of my podcast, where we talk about the immune system and implantation, you already know how important healthy immune function is for pregnancy. If you haven't caught that episode yet, scroll back and learn much more about the immune system and fertility as a whole. So surgery cannot change that immune system response or dysfunction. Surgery cannot lower systemic inflammation throughout the body. It cannot heal intestinal permeability or gut dysbiosis. It doesn't improve estrogen metabolism. It doesn't calm a chronically activated nervous system. It can't replenish nutrient deficiencies or mineral imbalances, and it cannot directly improve egg quality either. Egg quality is heavily influenced by oxidative stress, inflammation, mitochondrial health, nutrient status, toxin exposure, sleep, blood sugar regulation, thyroid health, and immune balances. There's lots of episodes that talk about egg quality throughout my podcast, which is like really a holistic approach. So egg quality can be improved with endometriosis. Surgery alone is not going to do that for you, though. Removing lesions doesn't automatically improve any of these symptoms. That's why surgery is often one piece of the puzzle. It can be a very important piece, but just one piece of that puzzle, not the entire puzzle. This is also why medications that suppress endometriosis, while sometimes appropriate for symptom management, don't address the underlying biology either. And IVF helps bypass certain barriers to conception, but it doesn't correct immune dysfunction. It doesn't reduce systemic inflammation. It doesn't improve the environment your eggs have been developing in for the last 3 to 4 months, and actually make it worse. A high estrogen environment created during IVF stimulation can actually worsen endometriosis as well. So I'm going to dedicate an entire future episode to that topic because it deserves much more conversation. But you may be wondering where we go from here. This is where I think the most exciting opportunities exist when we're talking about supporting endometriosis post-surgery or even pre-surgery to prep for it, and then post-surgery. If you're planning a surgery, or even if you already had that surgery, it's a perfect time to ask a bigger question. What allowed endometriosis to express itself in the body? Because that answer is honestly different for everyone. For one woman, it may be chronic inflammation driven by gut dysfunction. For another, it's immune dysregulation. For someone else, it's impaired estrogen metabolism, toxin exposure, mineral depletion, thyroid dysfunction, maybe it's insulin resistance or chronic stress that has kept the nervous system stuck in survival mode. So learning how endometriosis is expressing itself in your body allows you to create a much more personalized plan. This is why I often recommend comprehensive lab testing before surgery when possible, and then repeating key markers for a few months after surgery takes place to see where you're at, how that disease process is functioning post lesion removal, because collecting that data helps measure progress, see where your specific body is at, where it needs more support. And really, you want to be identifying what's still driving the inflammation after the lesions have been removed. Some of the areas I frequently evaluate include inflammatory markers like hsCRP, thyroid function, nutrient status. Iron panels are really helpful and informative. Vitamin D status, immune health, estrogen metabolism, gut health, blood sugar regulation, also really insightful too. These pieces help us explain why really two women with the same surgical findings can have completely different fertility outcomes and help us get you closer to that healthy baby, that BFP and that healthy baby. So let's talk a little bit more about the nutrition and supplementation piece. Food is always going to be our foundation. A colorful, nutrient-dense diet that's really rich in quality protein, healthy fats, seafood, vegetables, colorful herbs and spices, and fiber-rich, always for that gut health piece, is going to really help you provide the raw materials that your immune system needs to function well. But with endometriosis, the demand for certain nutrients is often much higher than we can obtain with diet alone. So there are several supplements with really encouraging evidence for helping reduce oxidative stress and inflammation alongside an endometriosis picture. Some that I commonly use and recommend when appropriate for an individual post-surgery is going to include vitamin C, vitamin E, omega-3 fatty acids, vitamin D, and acetylcysteine, also known as NAC, and melatonin. And again, these are not magic pills. They're tools, and they're most effective when they're supporting an overall strategy that includes the nutrition foundation, sleep, movement, stress management, gut health, focus, toxin reduction for sure, and personalized medical care around surgery too. And please remember that we're really focused on supporting the terrain, the whole body, not chasing symptoms. So if you've been living with endometriosis, I want you to hear this. There's nothing wrong with choosing surgery, and there's nothing wrong with needing IVF, but it's because sometimes those interventions are absolutely appropriate. But please don't let anyone convince you that those are the only conversations worth having. Your body is still communicating with you, and there is still really valuable work that can be done to improve inflammation, support your immune system, nourish your mitochondria to improve the egg quality, and prepare for that healthy pregnancy. So those things matter whether you're trying naturally, preparing for surgery, recovering from surgery, or planning for IVF. And surgery can absolutely be life-changing. And for many women, it is. But surgery is rarely the end of the story. So when you begin supporting your body as a whole, you give yourself the best opportunity for lasting symptom relief, healthier pregnancy, and long-term wellness far beyond fertility. So I'm really glad you tuned into this episode today. And if you did find this episode helpful for how your understanding endometriosis, I would love for you to share it with someone else who needs to hear it. And if you're looking for a root cause approach to improve fertility with endometriosis, I'd love to support you. You can find all of the resources we talked about today, along with the links to work with me and additional podcast episodes in the show notes. And until next time, remember this: your diagnosis does not define your future, and your body is always adapting to the environment that you're giving it. So let's make that environment one where fertility can thrive. Thank you for listening to this episode of the Fertility Dietitian podcast. If you enjoyed it, please leave a review to let me know what topics you want more of or less of. If you want to keep learning, subscribe at Apple Podcasts, Spotify, or wherever you listen to podcasts. Check out my website for more info on my private coaching program, Master Your Fertility, or my membership community, Fertility Blueprint. And don't forget my digital store. Come say hi on YouTube and Instagram. See you in the next episode.